Thank you very much, Dr. Navarro, for that very warm and very flattering introduction. As I've grown older, I've come to learn that there are only two groups of people that fall for flattery like that: men and women. So that was very kind. Thank you very much. And I must say, it's great to be here in Philadelphia. Let me just say that as a die-hard Boston Red Sox fan, I want to say to my buddies in Philadelphia, I hate the Yankees too. It is really great to be here at APHA. I've been a dues-paying member of this organization for a long time. Thank you. I've respected the passion and the compassion and the absolute dedication of this organization, and so it's a thrill to be addressing you here today. I want to extend my special thanks to my good friend, Georges Benjamin. What a tremendous public health leader he is. He deserves another round of applause here. And I am so delighted to share the stage today and work in administration with two fantastic leaders, Dr. Yvette Rubidoux and Dr. Mary Wakefield, and they deserve a round of applause too. Well, my special thanks go to all of you, because anybody who comes to the last session of APHA has got to be really dedicated. You've got to really care about public health. And so the question before us in this final session, the question that we think about every day, either implicitly or explicitly as members of this amazing field, is how do we make our nation healthier? That's the question for this session and beyond. And as your new Assistant Secretary for Health, I am deeply honored to embrace this question as part of this new administration, as a federal official, as one who is working very closely across HHS with members of other agencies such as CMS and SAMHSA and HRSA and the Indian Health Service. I've met many of you here. I have many, many colleagues in the audience from our immediate office, Julie Nowinski, our special assistant, our Commission Core leaders, the regional health administrators. We're here in Region 3 with Dalton Paxman and Michelle Davis, wonderful leaders. They deserve a round of applause. Thank you. I'm going to be talking about the work of our Population Affairs Office, Minority Health, Women's Health, but I think all of that discussion for today centers around the big question of how do we make our country healthier? In short, how do we build a better, healthy people by the year 2020 and beyond? And when you think about the challenges in front of us, the array of obstacles, the list is absolutely dizzying. From a global point of view, as many of you know, out of 19 industrialized nations, the US ranks 19th in terms of preventable deaths. There are at least 23 other nations that have a longer expected lifespan for their peoples than the United States. Around the globe, we are projecting 1 billion deaths due to tobacco addiction in this century, a figure fueled by an industry relentlessly pursuing the profit margin at the risk of the most vulnerable in our society. And by the way, in an ironic note, as one who has spent many years in tobacco control, it does give me some sense of irony that I am referred to as Assistant Secretary for Health, or the ASH. But that may be besides the point. In our country, we have 28 million people who are hooked with respect to substance abuse, less than 10% of them receiving services. We have over 1 million people HIV positive. We have millions of needy women needing family planning. As Fort Hood showed us just recently, we have tremendous issues with mental health and violence. We're facing new acute threats with H1N1 and growing issues with respect to climate change. All of us know that these are giant obstacles facing us on the public health agenda. but as my good friend Reverend William Sloane Coffin liked to say, giant obstacles are brilliant opportunities, brilliantly disguised as giant obstacles. And that's where public health comes in. And I feel so blessed and honored to be part of this amazing field with all of you, a field of inspiration, of passion, and compassion. Like Dr. Navarez, my parents were immigrants to this country too. They journeyed to the United States a generation ago from Korea, searching for the American dream. They raised me and my 5 brothers and sisters. And at moments like this in my journey, I think back to their sacrifice and their teachings to me and my siblings. They taught us that we were newcomers to this country. They taught us that many would consider us as not really belonging here. They insisted that we get the best education possible to reach our full potential. But more important than all of that, they insisted that we have a life of mission, a life of purpose, and a life of service. And I think about all those lessons from my parents as I enter this new post. For me, that meant becoming a physician. When you're the oldest son in an Asian American family, you're destined to be the physician. So I was happy to do that. Went off to medical training and was very honored to care for patients for 30 years and counting. And at the time, I was trained in the traditional medical way, as many of you have been as health providers, to focus on the individual biology of disease and to try my best to heal patient after patient put before me. But it didn't take too long to realize that there were many other forces impacting on the health of my patients other than individual biology of disease. The impact of poverty on human health, the impact of lack of education on human health, the impact of lack of insurance, discrimination, violence, substance abuse, the impact of lack of political leadership on public health. In short, the social determinants. What I didn't realize back then, but we all can articulate now, the social determinants. So that realization for me, like for many of us here, propelled me into a career of public health, this fascinating, frustrating, inspiring, passionate world. I went on to serve as the Commissioner of Public Health in Massachusetts from 1997 to 2003, as you heard, 4 governors, by the way. And then to a career in research and academia at Harvard before joining the department some 5 months ago. By the way, I do want to mention that many of you may know that I'm not the only Senate-confirmed member of my family committed to service. My brother Harold Coe is also Senate-confirmed. He is the former dean of Yale Law School, very committed to global human rights as a field, and now the legal advisor to Secretary Clinton and the State Department. I'm very proud of him. Thank you so much. Thank you. Many of you may know Harold, so just to clear up any confusion, I'm Howard. He's Harold. I'm the doctor. He's the lawyer. I'm at Health and Human Services. He's at the State Department. And yes, we do sort of look alike and sound alike. As he likes to point out, my mother now has 6 children, 11 grandchildren, a great-grandchild, and 2 Senate confirmations. So through this journey, my journey, your journey, our journey, we start to wonder and contemplate, how do we make our society healthier? And in fact, how do we define health? Every day on this new job, I think about the World Health Organization definitions of health. That health is, quote, a state of complete physical, emotional, and social well-being, and not merely the absence of disease or infirmity. I love that quote and think about it all the time. And that our common goal is to help all people reach their highest attainable standard of health. I love that line, the highest attainable standard of health.